with. So a little bit of OMOP and what we're working on. So OMOP is the Observational Medical Outcome Partnership. Our work focused mainly on the CDM level of OMOP. So as you can see here, we work mainly on the red circle part. So the clinical data tables, it's about like 10 of them, as well as the health data tables, because we think that's like the most relevant part to being mapping towards OPMI. Later on, we will briefly mention OMOP to OBO by Dr. Tiffany Callahan. Even though it's a very robust mapping work, it's mainly focusing on the standardized vocabulary section. And so we'll go into detail why we think this work is also pretty important in just a second. And so a little bit about OMOP CDM and its drawbacks. So first off is that it has very weak semantics, even though it has, it provides the schema and the tables to kind of like note down the patient's clinical data. It doesn't provide the semantic relationships between the terms. And second, it's that has very poor interoperability among other common data models. So like if you have data that follows, PicoNet CDMs or CDISC CDMs, it's hard to sort of integrate these data together. And so we think that ontology, especially in OBO ontology like OPMI, can help solve those bottlenecks. Okay, so I mentioned before that our work is rather similar with OMOP to OBO by Dr. Callahan. However, it's not quite good enough in the sense that OMOP to OBO mainly focus on the vocabulary side of OMOP. However, there's like a lack of systematic mapping of OMOP on the CDM level, like higher level to the table level. So our projects seek to address that little gap in mapping. Okay, so moving on to our methods, how our mapping strategy look like. And so we start from the source of how OMOP CDM is organized. So we start from their GitHub page, and then we use Ontology to seek out the terms that are already been ontologized in other ontology. And if they exist, then great, we'll import them into OPMI using Ontological. And then if not, then we can create new terms as well as its annotations. And this is the overall landscape of what the mapping looks like in the context of OPMI from a top-down level just within OPMI. Here is the sort of like a similar outlook of what OMOP would look like fitting into OPMI, but now with a different perspective. So this is a more patient, or as in the case of OPMI, is in person perspective. So we laid out so that we have the person as the centerpiece of OPMI, and then from then on, every other OMOP tables that are being mapped to OPMI can have that person to have like a reference towards, because we're mapping our data as patients. So we want to work with patients. Data just don't exist in the void. So okay, so a little bit of summary statistics for our work so far. We have mapped 165 terms from 15 OMOP tables directly to OPMI. And in addition to that, we generated 46 new terms that were either not imported, or we find that it's necessary to generate these new terms to round out the ontology model. Our current mapping focus, as I've said before, we focus on the clinical data table as well as the health data tables. Not yet included are the sort of terms that are not make sense ontologically. Things like metadata, Things like derived elements, they don't have a place yet in OPMI. And there are more things that I'll come to the next slide. Okay, so the things that I meant to also want to mention, things that when we kind of like summarizing them, the OMRSE terms by elements that we haven't yet mapped. A big glaring category that pops up is the source concept ID, and as well as the OMO source value. We haven't yet found a place for them to exist in our ontology yet, so we leave them out for now. An example of why this slide is relevant is if we look at the measurement table, there are three very similarly named terms like measurement concept ID, measurement source concept ID, and measurement source value. The source concept and the source value mainly works with the OMRSE side, and they don't have yet like found a place in OPMI, so we haven't yet mapped them. But the concept ID, we do map it. And then from then on, the process of how we mapped different OMO elements is rather very straightforward. So different OMO has segregated by tables. The more straightforward part, such as condition occurrence, it's mapped one-to-one with medical condition occurrence in OPMI. Likewise, device exposure, drug exposure, procedure occurrence, medical visit, it's mapped very straightforward to OPMI. And all the ones I've listed so far, they all fall under the medical occurrence. Next is the mapping of time in OMRSE. So the ones that I've listed just a slide before, they have their own dedicated table, and so it's very convenient and like very easy to organize. However, how time is organized in OMRSE, it's seems to be like scattered towards among 6 different OMRSE tables, and so we essentially give them a home in OPMI under a very organized fashion. And with that out of the way, the story of mapping, it's the same as before, very direct, one-to-one, no fuss over there. Next up, we'll talk about the use case of OMRSE to OPMI. So we can use OMRSE to OPMI for what we aim to do so far is the ontology level data standardization. This is just due to the root of OPMI as ontology, and it is also interoperable ontology, so it can be used to enhance other ontology and vice versa, having other ontology working with OMRSE to OPMI to enhance its use. Our second use case is to use our ontology to map, model, and then analyze adverse event. So in OMRSE, there's no quite a adverse event term. However, we can still use our existing data and try to extrapolate an adverse event model. And so here we borrow the adverse event model from OAE. It's rather simple. You have a patient, you have a medical procedure that they go through, and any sort of symptoms or that they experience after they had the surgery that they did not experience before, that would be classified as adverse event. So it's a very generic model. Next is how that generic model would fit into, again, the landscape of OPMI. Now we still have the same 3 elements: the person, the intervention, medical intervention like surgery, and the adverse event. But now it has how it would look like with other extra tables that surround them. And lastly, this is how it would manifest in a real life use case, how we can apply the AE model in OPMI. So this is a very specific use case based on the heart surgery, acute kidney injury first event model. So we have patients who have heart surgery. These patients did not have kidney injury before, but they have it after the surgery. So they would be qualified as patients who have kidney injury as their adverse event. Okay, and then last use case is to use ontology for COVID-19 based clinical analysis, and as well as modeling and data standardization. This use case is two prongs. First is to use the adverse event model that we had and apply it to study COVID-19 adverse event using FAC data. And the second is to combine it with CIDO for mainly literature management and data sharing. Okay, so that is very much it of my presentation. So to sum up, OMRSE is the data standard in observational data and analysis. OPMI is the ontology that we try to map OMRSE towards, and we've been doing it in this project, and we mainly focus on the CDM levels. The three use cases are ontology level data standardization. We use OPMI to map adverse event, and we use it to study different aspects of COVID-19. Future directions, we could potentially use our work so far and extend it to map other common data models as well, such as EcoNet or CDISC. We can have more COVID-19 related adverse event studies, and maybe even expand it more and fill in the gap of what we've been missing so far in the work of mapping OMRSE, because it's not quite finished. So more mapping. Yeah, so I think that is it for my presentations. Any question?
There's comments online.
Oh.
Right. Yes. So Mitra Roca actually, she's from FDA, and she was trained by she has been done this work, common data harmonization.
Okay.
CDMH, and her team mapped PCORNet Sentinel OMRSE I2B2/ACT to I2B2, and now they are moving it to also representing it to FHIR. So I guess she is wondering, how will you harmonize with what she's doing?
Could you rephrase the question?
So what you are doing, it seems like you are ontologizing one CDM.
Okay.
Model that is OMRSE. Okay. And in addition, there are some work already existing because there are many CDMs out there that is being used by different communities. OMRSE is one of the big one. There are PCORNet is another common data model, and Sentinel is a project initiated by FDA, and there is a Sentinel common data model and I2B2.
Okay.
/ACT. So her team mapped all this common data model into I2B2.
Okay.
So now you're doing another map to OMRSE to OPMI. So how do you see these two parallel work come together? Oliver, maybe on this?
Yeah, maybe I can answer. Yeah, thank you very much for the talk. So yeah, so definitely this is just beginning as introduced in the discussion. So we want to first try OMRSE because it has been used by NCC, and so it's one of the most popular ones. but definitely we are looking forward to mapping to others. So hopefully then ontology level can become a common sense linkage, right, to different CDMs.
Yeah, so Mitra, actually I realized that.
Yeah, yes.
Yes, please.
Oh, sorry. Thank you, Oliver. Yeah, just one thing. In phase 1, we harmonized it with the bridge model, which has the city standards, because I saw on the slide that lack of semantic interoperability, like cities doesn't have a model. They're just a set of data elements in their standards. So that our project also, the reason we used the bridge model was because cities standards are harmonized with bridge. But in phase 2, which is ongoing now, we are using HS7 Fire among all of these 4 common data models.
Yeah, that's great. I think definitely it's a complementary work. So CDs is quite famous. So like what we are doing is at the ontological level, right? So ontology, basically we want to use ontology to represent the reality. So although there are many different CDMs, you would think those CDMs are talking about the same reality, right? So at least at the ontology level, the assumption is there's common representation, right? And like OPMI is a part of the open foundry. So we want to basically to be an interoperable ontology that can represent the realities, among different CDMs. And hopefully, the assumption is by doing so, it can be useful. Thank you.
Yeah, thank you.
Yeah, we still have 4 minutes. Any more questions? Yeah, I have one. So do you have a use case after your mapped?
Yeah, so the AWS event use case actually was done a couple of years ago in our OPMI talk. It was more like in one of the ICBO meetings. I was in Oregon. I presented there one, but it was definitely small size of some kidney related use case. And now our use case is more like N3C, the COVID-19. We want to still, because we think our model of adverse event is a good one, we want to still work on the adverse event, like vaccine adverse event or drug adverse event. But now we want to use N3C data. So this one we just started, we haven't finished that one. But I think that this is a major use case in our mind. But definitely we can use it for different other use cases as well, like looking for variables, all those variables, we affect the outcome. Basically, yeah. Yeah, so yeah, we actually started many years ago on this project, actually before the Tiffany's homework to CDM. So and then I talked to Tiffany, about this one, and we are happy to work together. And but definitely our goal is not only homework. Right? We want to go for cities and keep on that and others as well.
But you could take advantage of what Mitra has done in already mapping
Oh,
to see what
yeah.
you can get from your ontologizing OMA. What else you get from PCOR, for example.
Yeah, so this was a very difficult topic to actually get nailed down. So thank you for the introduction, and let's get right into it. So as many of you have already heard this week, money and health are closely intertwined. Higher income is associated with better access to schools, nutrition, recreational resources, and housing. And then healthcare centers and organizations have become increasingly interested in collecting data on this as it relates to social and economic determinants of health. So there are a number of tools, as you all have also seen this week, that do screen for these factors, these social and economic factors. Oh, Oh, I think it's this one. Did it move?
Yeah. It just takes a little bit of time. fence, the big move.
Okay.
No, you did something before. You did something before and it worked.
The thing I did before was move back to the first slide.
When we saw the ground. Yeah. Okay, yeah.
You have to move backwards.
I don't, okay.
Try it.
I'm moving backwards and it's moving forward. All right. So, oh wait, this one changed. The one that's the type.
So that one is the one saying to the screen. Your computer is the one that's in control. I think.
Oh.
The one on top is in control?
Yes.
Because this one right here is on this screen.
So,
This one
you
is
know,
not.
yeah, they want to make things more complicated.
Okay, okay, this is only if you have notes to present to you.
Oh, I
Otherwise-
don't have notes.
Okay, then we just use
Beautiful.
this one.
Beautiful. Okay.
Sorry.
We're good. Thank you though. Oops. What just happened?
Need to share a screen. That Wednesday. This is yours.
Yeah. Yeah. Thank you.
Yes. Sorry, I was a bit slow getting up.
That's all right. That's all right. Okay, no, it's not moving. Let's see. There we go. Did it move?
Yes.
Okay. So, just to recap real briefly, money and health are closely intertwined. There are a lot of tools, as many of you have been presented with this week, such as the Prepare screening tool, the Epic Healthy Planets SDOH module, that collect this data and often integrate it with electronic health records. So as an example of this, this is from the Prepare screening tool. So this first question asks, during the past year, what was the total combined income for you and the family members you live with? It allows you to type that in or choose not to answer. And then there's another one that is kind of relevant to income where it asks, in the past year, have you or any family members you live with been unable to get any of the following when it was really needed? And then it'll list a bunch of different needs such as food, utilities, medicine, and phone. So now the question comes to what is money? And this was a very, very tricky thing to figure out. And so when economists talk about money, they often refer to 4 quote unquote functions of money. These are not BFO functions. These are functions in the colloquial sense. So they typically look at, or they typically define money as having these 4 functions, those being medium of exchange, meaning that it is widely accepted by a group of people in exchange of goods and services. The second function is measure of value. So it serves as a standard unit of measure for the value of a good or service. There's a standard of deferred payment function, which means that it is widely accepted by a group of people to value or settle debts, such as taxes. And then lastly, it is a store of value function, means that it retains its value after being stored and retrieved at a later date. That last one basically essentially says that this is the value of this is supposed to remain relatively stable over time. Some economic textbooks leave out measure of value and say that it's subsumed by store of value, but we decided to at least cover it here in the background. And so this might seem very counterintuitive, but economists also consider money to be a type of debt. And in fact, one of the earliest proponents of money being a type of debt himself admitted that the main obstacle to the adoption of a truer view of the nature of money is the difficulty of persuading the public that things are not the way they seem. And in fact, the modern economic banking system or economic system has adopted this viewpoint. even though does seem a bit counterintuitive. Hopefully this example that I'll give might clear this up a little bit, what I mean when I say money is a type of debt. So a banknote, like a dollar bill that is issued by a central bank, represents an obligation of that bank's government to accept it as a means of paying for taxes, fines, or government debt instruments. On the other side of that is whoever's in possession of that money has a claim to that obligation. And so in the United States, legally speaking, Federal Reserve notes are liabilities of the Federal Reserve banks. If you don't believe me, the Federal Reserve website will tell you this explicitly. And then when you look at historic examples of debts being used as money, you'll find these pretty widely throughout history. So there's cigarette money that was used in World War II prisoners of war camps, and then Babylonian clay tablets where you would basically record the obligation on a clay tablet, and then once that obligation was met, you would break the tablet. So there are some existing classes for money in various ontologies. I was able to find two looking at OntoB and BioPortal. So there's the gender, sex, and sexual orientation ontology. They define money as any item or verifiable record that is generally accepted as payment for goods and services and repayment of debts such as taxes in a particular country or socioeconomic context. So the one area where this definition falls short is just that it doesn't really account for the fact that money is considered a debt. And then there's the National Cancer Institute thesaurus's definition of money, which is that it is the official currency issued by a government or a national bank. So the NCIT also further defines government in the thesaurus as the political organization by which a state or nation is ruled. Unfortunately, the consequence of this is that the euro, according to the NCIT, would not be considered money. Although I think they would disagree with that and would probably want to fix that. And that's probably something that I should make them aware of and something that I intend to do. So before I could go into defining what money is, I first have to figure out what a debt actually is. And if I want to do it in an Obo Foundry ontology, I have to figure that out in BFO terms. And so in doing this, I tried to rule out what it was not, because it wasn't really apparent at first exactly what it would be. And so the first thing I ruled out was that it wasn't a BFO occurrent because neither debt nor money has temporal parts. I also ruled out that it was a ruled out material entity because money and debt can be immaterial, for example, checking deposit accounts. Third, I ruled out immaterial entity since debt is not a site, continuant, fiat, boundary, or spatial region, all of which are subclasses of immaterial entity. And then lastly, I ruled out specifically dependent continuant since there can be multiple material and digital forms of money and debt, and these are all transferable from one source to the next, which a specifically dependent continuant is not. So this left generically dependent continuant. And when I looked at this, it started to make a little bit of sense that this could be a possible parent class. So for example, there could be multiple records of a particular debt and multiple instances of a type of currency. That fits in with the definition of generically dependent continuant. Like other GDCs, money can be identified by copyable patterns that are concretized as a BFO quality. So on a dollar bill, the patterns of ink that are drawn on that dollar bill by the Federal Reserve would indicate that that is an authentic piece of money, at least in the United States. So the next question was this sufficient for representing debts? And so I took a further look at Obo Foundry ontologies, like IAO, for example, and I discovered that there probably were even more specific classes that were GDCs, but that would be better for representing debts. And the one that I finally decided on was directive information entity, which is defined in IAO as an information content entity whose concretizations indicate to their bearer how to realize them in a process. So any concretization or I guess in lay terms, any record of a debt will typically indicate how the debt is to be realized. So in the case of currency, the concretization indicates an obligation of the issuing government to recognize it as a payment for taxes or treasury bonds, right? You look at that dollar bill, or you look at that dollar bill, and if you're paying your taxes with it, then they have the obligation based on the ink patterns there to recognize it as fulfillment for your taxes, if you're paying in cash for whatever reason. In the case of an online record of your checking account, the concretizations indicate an obligation of a commercial bank to provide you with funds upon request up to the amount that you hold in that bank. And so from this, I defined a debt obligation as a directive information entity that prescribes that something will be transferred from some human or organization that is the bearer of a duty holder role, which I borrowed from the DX ontology, to another human or organization that is the bearer of a claimant role. So each obligation will have an associated claimant role and duty holder role to indicate which party bears the claim and which party bears the debt respectively. Claimant role also comes from DX. And so now we have a definition now we can nail down a definition of money. And so we propose defining this as a debt obligation between two parties that has as part a scalar value specification and whose concretizations indicate that their bearers can be used in a financial transaction or payment of debt, or as a measure of the value of some entity in a financial valuation process or prospective financial valuation process. In each of these processes that I mentioned here, we also explicitly define. And just so to clarify here, so for the scalar value specification aspect of money, for currency, it is whatever value has been assigned to that money or that current piece of currency by an issuing government. So a US $1 bill will have a scalar value specification of $1. For other types of money, such as various historic forms of money that use just everyday objects, the scalar value specification will be equal to 1 unit of that form of money, or will derive this value from other commodities of the same type. So for example, a hand-rolled cigarette in a prisoner of war camp might be worth 2 Red Cross cigarettes, and thus it'll have a scalar value specification equal to 2 Red Cross cigarettes. And so this is just a diagrammatic illustration of what this might look like. So you have money down here as part of scalar value specification. That money is about a duty holder role and claimant role. And then this is just kind of an example here. You could say that the duty holder role inheres in an organization and the claimant role inheres in a human. Some cases, it'll just be two. It might be, well, I guess with money, it'll mostly, actually, the duty holder role will mostly inherit in an organization. And then the claimant role could also inherit in other organizations, like a business, or yeah, a business is a good enough example there. So now I'm going to get into some of the processes that in which money is used. So for financial transaction, we define that as a planned process whereby one participant partly or completely fulfills an obligation to another participant by transferring ownership of some other debt obligation, which is typically money. Although we note here that it could be other forms of debt obligations, such as bonds, that are used here. It's not restricted necessarily to money. For payments of debt, we define this as a planned process whereby ownership of some entity of value is transferred by one participant to another to fulfill some obligation on their behalf after some service is performed or the ownership of some entity is exchanged. So some debts can be paid with material entities. If I borrow $5 and pay it back by buying you lunch, that obligation might be considered to be fulfilled as long as you agree to that. And then the last two processes that I mentioned in the definition of money. So there's financial valuation process. This is a planned process that has a specified output, some scalar measurement datum that is about an entity such as a material good or a service and is measured in terms of the quantity of some other entity, oftentimes money, but in some cases you actually might value something in a different, using something that's not money. Like, for example, if an item on a menu, using the example from the previous slide. of paying a debt obligation by buying somebody lunch. And then lastly, there's prospective financial valuation process. So this is basically talking about making an estimate about what the future value of something will be. And we define this as a planned process that has as specified output some predicted value that is about an entity, such as a material good or service, and is measured in terms of the quantity of some entity at some point in the future. So, and then lastly, we define currency. So this we define as a material entity that is the bearer of a concretization of money and is created by some governmental organization or on behalf of some governmental organization that has authorized its creation. And the reason we decided to define it this way is because currency is anything that has been declared by a government to be an acceptable means of settling debts and or as a medium of exchange. And almost universally, they are physically manufactured and issued by government institutions. There might be some cases in the future where digital currency comes into play, in which case we might have to reevaluate this definition or just classify that as something else entirely. But as of right now, like the United States, there are no digital currencies. I think the only country to my knowledge that actually has a digital currency is Nigeria, but I might be mistaken there. And then just for clarification, cryptocurrency does not fall under this at all. And then lastly, okay, so by government fiat, copying and counterfeiting is prohibited and increasingly made physically challenging, but these actions absolutely remain physically possible and thus do not in any way detract from the definitions of currencies as GDCs. So just some limitations and future work. Our definition of money aligns with current types of money that may be fundamentally different from some historic types of money, such as cowry shells. So when we did our research on this, we were not able to find a debt-based account for cowry shells, although that might partly be because of just a lack of historic knowledge about this financial system. And so this might limit its generalizability. We also did not or have not yet represented certain entities that are used as forms of payment in financial transactions, such as checks or bonds or other financial assets. And so this remains future work. And then other future work includes representing entities involved in digital transactions and financial assets relevant to health and healthcare. And then lastly, I'd just like to acknowledge our funders, my PhD committee, including my committee chair, Bill Hogan, who's here today, some of my colleagues, Clint Doland, my personal assistant, Linda, and then all of the ICBO reviewers who had very thoughtful comments, as well as the attendees to the 8th Clinical and Translational Science Ontology Workshop, who gave a lot of good feedback as well. So thank you.
Thank you very much for this very interesting talk. So I kind of wonder if you have looked into the definition of money by John Searle in his book, The Construction of Social Reality. Because he reduces money there to some fundamental social acts, which you do not seem to consider very much. By social act, I mean that a certain group of people will have to agree to accept a certain token, a physical token, as a medium of exchange. And this society, of course, may at some point no longer agree, and then this token becomes worthless, which happens in, I was in Zimbabwe some time ago. I had a lot of tokens, but they were literally not worth very much.
Right.
So this is maybe my first question. If you have considered and compared your approach to John Searle's definition of money, and the second is, I will just more a comment, because I don't actually agree that cryptocurrencies are something entirely different. I think any approach to money would also have to consider cryptocurrencies today. And then there are lots of things which may not necessarily contradicted, but I think they would be quite different.
Yeah, so these are great questions and comments. So to address your first one, so I'm familiar with Searle's work, and there's a whole aspect to the social reality of money and the agreements between different people, individuals, and institutions that just I have not yet had time to really dive into and try to represent in an ontology. I think that's really fascinating work though, and it's something I would like to try to do at some point in the near future here. And I do think that, yeah, there is that aspect of agreement in terms of something being considered money by a certain population of people, where so I agree with your statement about that being a possible shortcoming of this definition. And it's something that we will, like I said, have to look at. As with cryptocurrency, I meant to actually include a slide specifically to address this question, but I just did not have time to. So I think I'll have to look again, and I can email it to you. There was a study that looked at the volume of cryptocurrency. I think they might have just looked at Bitcoin, which is the most popular one. And they found that in reality, cryptocurrency doesn't really move around that much in terms of people's accounts. It is generally considered by the people who possess cryptocurrency, it's generally considered to be more like a highly volatile speculative asset. And then when you actually look at the trading that does happen, there was a recent report by, I think it was Forbes, that found that the majority of trades, I think it was with Bitcoin, were wash trading, which is just fraudulent trading that happens where you put, you sell some Bitcoin and you quickly buy it back from yourself. And this kind of artificially inflates the price or value of that token or currency or cryptocurrency. But again, that also points to it being more of a speculative asset than something that's used as money in exchanges. And then thirdly, if you were to actually walk out these doors and try to buy something here in Ann Arbor with Bitcoin or any other cryptocurrency, most businesses will not accept it. And so I think it actually runs aground of the aspect of what you mentioned with Searle, and people just accepting it as being a form of money, that it might violate that particular principle.
Want to buy drugs.
Yeah. So yeah, if you yeah.
So what is this?
That would be a banknote, paper bill, $1 bill. It would be a material entity based on my definition here that concretizes $1. So yeah, that would be currency.
Currency?
Yeah.
And it's not money.
It concretizes money is based on this definition.
Hi.
Yeah.
So you propose asking the NCI to make changes to their definitions between money and government. In NCIT, government is a conceptual entity and money is a manufactured object. Both of those come from different branches which are disjoint. So how do you propose to ask NCI to make changes?
I would probably just ask them to broaden their definition to that's actually something I haven't thought too much about, is how to fix that definition. But my inclination would be to broaden it so that it doesn't necessarily have to be something that is issued or created by a government entity.
So I do have a comment though, so that you have to ask them to make changes more than to just the money class, because if they change the definition of money, then the parent class is wrong.
I see.
Why is a thesaurus that's fundamentally meant to cover cancer and some related medical items covering money in the first place? Why would we look at them to be an authority on how to define money?
That's fair. I mean, I just wanted to be thorough in making sure that there was looking at what was out there already and not trying to duplicate other people's work. I could see there being a use case similar to ours where they're trying to use it when talking about income and things like that. I actually don't know how they're using that concept. And then to the other gentleman's question, yeah, that would be a very tricky thing to actually ask them to change government and then or